Good morning, world. The other day, I received a message from a woman who suffers from ADHD, and she had concerns that two of her children were showing signs that she thought may be symptoms that they too suffer from ADHD. And of course, she's worried that maybe she passed on her ADHD to them. And her question to me was, is ADHD inherited? My best answer is that as of today, it is not something we consider to be passed on from parent to child. But there are studies being conducted every day, and there's no telling what findings are going to be coming out next year or even next week. So it is not just, yeah, like with many other mental illnesses, we may find something at some point, but as of right now, it is not considered passed on to the child from the parent. However, because ADHD is so behaviorally displayed, it is possible that a parent may be showing or modeling behaviors that the child is learning, and that eventually when they reflect that behavior to you, you see them as signs that the child has ADHD, but it's really a sign that your child is a great learner and learned very well from you. And that is why today we're sharing 5 tips to help children whose parents suffer from ADHD. And first is to get them on a schedule. Just as it's important for the adult with ADHD to have schedule, it's nice for children to have schedules. They start learning to set routines. They start learning that there is an order to things, and they start learning that, a day is not just doing one thing. There's a time for this and there's a time for that. So getting the child on a schedule, but make sure you understand that they are children. So you have to make sure that their schedule reflects the child that they are, meaning that their schedule needs to have free time. Their schedule may need to have nap time. It may need to have play time. Whatever times a child of that age requires, make sure you're building it into the schedule you are helping or setting for them. So you can't just have the child going from activity to activity to activity when a 5-year-old is not built to sit for 2 hours. They're just not. So make sure that whatever schedule you're setting up for them takes into account their age and the needs of a child of that age. 2, teach them how to plan and use timers. In 5-year-old time, 5 minutes is about 3.5 days, maybe 4. So when you have a child set to do something, it's nice for them to understand, yes, I'm going to do this and then I'm going to do that. But since I really don't want to do this, when the alarm beeps, when the timer goes off, I can stop and go do this that I want to do. So having them understand that even if they don't want to do something, they can do it for a certain amount of time, and there's a natural end to it, and they will know when that end comes. And of course, for the things that they like doing, that they also understand that yes, we may like coloring, but we can't color 24 hours a day. At some point, you got to get up and go to bed. So having them use timers will help them start learning that things start and things come to an end. And of course, having them plan. It's like, okay, you know that you want to go ride your bike. What do you need to do in the morning so that at 3 o'clock or when mommy gets home, you can go ride your bike outside? So helping them understand and setting those types of plans. Engage them in organizing. Being able to see and find and know where things are is very important to keeping you on task, to helping you do things when you need to do them. If you need to do your homework and you still have to spend 20 minutes finding your backpack or finding your pencil, that cuts into your homework time. Having them learn early on to organize. Hey, this goes in the yellow bin, this goes in the blue bin, this goes in the wherever. Engaging children in organization help them form the habit so that even if whether or not they have ADHD, as they grow up, they will be better prepared. They'll be able to understand how to make life works and organized and carefully crafted life works. 4 is to monitor their diet and get them eating well. One of the bigger issues with ADHD, of course, is the hyperactivity. That's the one that really bothers most adults as far as children are concerned. But a lot of time, children can be hyper. They can have that extra energy from a lot of the things that we feed them, a lot of the things that they consume. Caffeine and sugars are two big offenders. So make sure that your child is eating enough things that are giving them a regular, normal, sustainable energy that lasts all day, and not that peaks and valley type of energy that they may get from sodas or candy, that they are super hyper 1 minute and then eventually they crash, because that's just the way those peaks and valleys type energies work. So make sure that they're eating well, that they're getting their vegetables, that they're getting their fruits, and things of that nature, and that not too much sugars, and not too much caffeines and other processed foods that may be impacting or making their energy levels yo-yo. And finally, praise and reward them, because you're teaching behaviors, and the best way to get a person to learn and maintain new behaviors is to have a reward system. Make sure that when you're asking your child to follow through and learn new behaviors, that you're praising them when they actually do these things you're asking of them. Because, if you acknowledge, if you let them know, I see, I appreciate, I understand, I get that you're doing this, you're encouraging them to continue to do that. Whereas if you focus more on when they're not doing it, then you're giving them attention when they fail or when they neglect doing whatever it is that you're asking, thus encouraging them to neglect what you're asking in order to get the attention that they desire. So make sure that you are sharing, you are giving out, you are rewarding the behaviors that you want instead of the behaviors that you do not want. So quick recap: get them on a schedule. Make sure that you include a lot of free time and a lot of time on whatever is appropriate for their age. Teach them how to plan and use timers, because it's a lot nicer to do things when you know that the things you don't want to do eventually end. Engage them in organizing, because it's nice to know where everything is, so that you don't end up spending too much time just getting ready to do the things that you need to do instead of actually doing them. Monitor their diet, because a lot of foods have that peaks and valleys type of energy, like sugars and sodas, that are not necessarily the best for your child. Praise them and reward them when they do the things that you're asking them to do, because that encourages them to continue doing it. That is it for today. Good morning, world. Have a great day.